A very good evening to all of you. Myself, Dr. Pratik. So let's talk about paranasal air sinuses. So we all know the respiratory pathway are lined by pseudo-stratified ciliated columnar epithelium. So if we talk about the nasal mucosa, if we talk about the tracheal mucosa, if we talk about the mucosa in the larynx, there are exceptions in the larynx, like the two vocal cords are lined by the squamous epithelium. But most of the respiratory pathway is lined by the pseudo-stratified ciliated columnar epithelium. Important point. Another important point, the nasal cycle, the duration varies from 2.5 hours till 4 hours. So one nasal cycle get completed in 2.5 or within the 2.5 to 4 hours duration. Third point important, sinuses are ventilated mainly during expiration, so known as eddy current. So sinuses are never or least ventilated during inspiration, they are mainly ventilated during expiration. All 3 points are very important considering the exam. So let's talk about maxillary sinus. We all know, suppose this is my nose. So in both the cheeks there are two group of sinuses which are known as maxillary sinus, like this and this. So maxillary sinus is first to develop, very important, has been asked multiple times. First sinus to develop in a baby, maxillary sinus. It is also known as antrum of Highmore. It is the largest sinus out of all the sinuses and the volume is 15 ml. Important, has been asked multiple times. So what is the volume of the maxillary sinus? 15 ml. And it achieves maximum size at the age of secondary dentition, like at the age of, like suppose 14 to 15 years of the age. So maximum size attains is at the level of secondary dentition. Maxillary sinus is the first sinus that appears in a newborn baby and the volume is 15 ml. So this is a sinus where the ostium is at the upper end. So the drainage of the maxillary sinus is by anti-gravity. So the ciliary function need to be perfectly fine so that complete collection of the maxillary sinus can be drained out into the nasal cavity. So this is the sinus which is having anti-gravity drainage because the ostium is at the level of the superior wall, superior-medial wall. So this is the reason it is the most common sinusitis in adults, especially adults. Most common sinusitis in children is ethmoidal sinusitis. If we talk about adults, most common sinusitis is maxillary sinusitis. Again, very important. The pain will increase on movement of the jaw. To drain out the sinus, we can do the Caldwell-Luck operation where we perforate or enter into the maxillary sinus at the level of second premolar or first molar. Okay? So this is the area where we put a hole to enter into the maxillary sinus. The procedure is known as Caldwell-Luck surgery. Then comes ethmoidal sinus. It is most common sinusitis in children. In adult, it was maxillary sinusitis. In children, it is ethmoidal sinusitis. It is a sinus which is mostly pneumatized at birth. Which is the sinus which is present at birth? Maxillary sinus, first sinus to appear. Second sinus is ethmoidal sinus, which is mostly pneumatized at birth. The pain increases on eye movements. Third sinus, sphenoid sinus. It is the least site of sinusitis. There are anatomical variation or anatomical structure is there. One is the conical type, then come presellar and sellar. So least site of sinusitis again has been asked in the exam. Then comes frontal sinus, not present at birth. Asked 2-3 times. Which is the sinus which is not present at birth? That is frontal sinus. It generally appears or start appearing at the age of 6 months, or not 6 months, 2 years around. It is having gravity drainage. That is, this is my frontal sinus draining by the means of gravity. So generally frontal sinusitis will present as a morning headache or office headache, because when patient wake up with the frontal sinusitis, he will have headache. But with time, if he is walking, so because of the gravity, the collection of the sinus will get drained out and patient will get relief during the daytime or during the evening time. So that's why the headache is morning headache or office headache. So what is the status at birth? Maxillary sinus, all the three sinus are present at birth except frontal sinus. Frontal sinus absent at birth. Adult side attain maxillary sinus at 15 years, small adults 12 years, frontal sinus until adolescence, and sphenoid again 15 years to adulthood. First sinus that we can see in X-ray in the babies. So maxillary sinus, first sinus to develop, we can see in the X-ray at the age of the 4 to 5 months. Whereas the ethmoid sinus we can see at the 1 year, frontal sinus 6 year age, and sphenoid sinus 4 year age. What are the best views or type of X-ray? For maxillary sinus, best is Waters view. It is also known as occipitomental view. We will see in the next slide. For ethmoidal and frontal sinus, the view are cardinal view, and for the sphenoid sinus, it is lateral view. Look at the picture X-ray. This is my frontal sinus. This is my ethmoidal sinus. This is my maxillary sinus, and the posterior one, this is my sphenoidal sinus. Now look at these two type of X-ray. Waters view, also known as occipitomental view. Important, asked in the exam. What is the cardinal view? It is occipitofrontal view. So cardinal view is a better view for the frontal sinus, whereas the Waters view is a better view for the maxillary sinus. These are the projection, how we project the X-ray beam.